According to the National Safety Council and medical research, 20% of backaches are attributed to inflammation such as arthritis. 10% are due to actual back injuries and other miscellaneous causes. 70% result from degeneration of spinal discs. That's right, aging of the spinal disc material causes the most trouble and can cause extreme pain even from routine body motions. You've all heard the routine warnings about bending your knees and lifting with your legs. We see people lifting boxes to demonstrate the proper technique. Those techniques are still correct, but we don't always pick up a box, or the item we want to lift is sitting under a storage rack or other difficult position. Today, we want to explain how the back works so you'll have enough information to make the right choices on how to lift anything safely. We'll also discuss how strains and muscles work so you can prevent these types of back injuries also. There's no magic formula. All you need is a good attitude about safety and are willing to think about safety every time you lift anything. If you'll do that, it's difficult to have an injury. First, let's talk about the mechanics of the back. Each disc is a circular pad filled with gelatinous substance under pressure. The disc looks like a soft hockey puck with jelly on the inside. The disc works like shock absorbers or springs that provide a linkage to the vertebrae or bones, but prevents any sliding of one vertebra against another. The spinal cord is a bundle of nerves in a protected vertical passage behind the disc area. Nerve roots branch out through spaces between each vertebra and go to different parts of the body. Many times we must lift something over our head, so you're going to stretch your arms to reach the object. The best way would be to set the lifted object on a table or other support, then reposition the object so your arms are doing the lifting, not your back. As a minimum, reposition your grip on the object to keep the weight centered. Arching the back during a lift makes nerve roots susceptible to pinching. Just remember how the discs protect the back and try to make the lift with your back as straight or in a normal position as possible. When you do this, the discs can do their job without damage and the ligaments aren't stretched so far that they'll tear. Naturally, medical research has provided us with some basics about your back to help you understand how the back works. The back works like any other machine on the lever principle. You have a load and a counter load. The load you're lifting and your back balanced on a pivot point or center of gravity. The heavier the load, the more counterweight you need, or some position to help offset that load. The back has a 10-to-1 ratio to the object you're lifting. If an object you're lifting weighs 10 pounds, it's going to take 100 pounds of pressure in your back to lift the object. This puts a lot of pressure on those delicate discs. Add in more weight, more length of the lever, or an awkward position, then you're adding much more pressure on those discs and, of course, the ligaments. That's why you hear safety and medical personnel telling everyone to bend your legs and squat down near the object you're going to lift. This keeps the discs lined correctly between the bones. Get a good palm grip. Don't use your fingertips to make sure the object you're lifting doesn't slip out of your hands. Lift the object slowly to prevent any jerking movements that can cause discs to move out of their proper alignment and bring the object close to your body. This reduces the lifting pressure based upon the 10-to-1 ratio of the lever. The closer the load, the less pressure it takes to lift. You have a good grip. The object is close to your body. Now stand up. You're using your leg power to do the lifting, not your back. That's the standard method of lifting safely, and it does work.